Assalamualaikum and hi everyone. We are from Group 35. We'll be presenting about the role of carers in depression in elderly. Okay, the main reason why we choose this topic is to create awareness about depression, especially in elderly. Furthermore, from this project, we want to highlight the caretaker's responsibility in managing depressive elderly. Okay, moving on to the objective of our project. Okay, first is to list down the risk factors, signs and symptoms of depression. Second is to summarize the prevalence and the role of carers in management of depression in elderly. And lastly is to educate people about the role of carers itself through brochure and video.
For methodology, all information related to our topic was acquired from reliable sources like articles and websites. Interview session with a geriatrician and a caretaker were also conducted to gain more insight comments. All information are then gathered and compiled into a brochure, which is made using an online application. Finally, a video is recorded to elaborate more on the topic.
Next, we go to the findings and discussion. From a review article, it is stated that 16.5% of elderly is having depressions. So it is important for the family member to know about risk factor, signs and symptoms of depressions in elderly. A research has been conducted and it shows women have higher prevalence of depressions in the later onset of age. Other than that, some medications such as beta blocker, corticosteroids and levodopa can also induce depressions. Stressful life event might also contribute to increased risk of having depressions in elderly, such as death of the loved one, financial problems, medical conditions such as stroke and cancer, loneliness, and also abusive household. Older people might have different signs and symptoms from the younger patients, which these lead to difficulties in diagnosing depressions in elderly. They tend to withdraw themselves from the society and are more comfortable to be alone. They tend to isolate themselves from joining any social activities. They also will have no appetite, which lead to significant weight loss. Not only that, but they will also have difficulties in sleeping, which will disrupt their daily routine. They will be tired due to lack of sleep. This will lead to neglection of their daily needs such as taking medicine, taking shower, and taking a proper meal. Some of them will have recurrent thought of suicide, which it is important for the family member to make them talk so that they can share their thoughts openly. Other common signs and symptoms are loss of memory, lost interest in hobby, feeling hopelessness, and feeling sad. Different people have different signs and symptoms. There are some people that might not have any prominent symptoms, so it is crucial for the family member and caretaker to be alert even on the small changes of the elderly's behavior.
Role of caretaker in management of depression in older people. First, you need to develop on understanding about the illness, which is depression in older people. What we can do, we provide the right education, the right information about the patient condition to the family's member. And the second point is the most important. We need to support your family members. Support can be in many ways, like you can providing the transportation for hospital appointment, you can spending your time listen to their problem, or you can talking to them so they will be less lonely. And then the third point is you need to be more alert. You should be more alert about the sign and the symptom of the depression in older people. And the last one is you need to require a lot of patience or dedication to managing in elderly with depression.
In conclusion, the prevalence rate of depression in elderly is 16.5%. The elderly are more prone to getting depression if they are suffering from comorbidities, self-isolation, and stressful life events. This can manifest as self-isolation, weight loss, neglection of self-care, and memory problems. Thus, caretakers plays a significant role in managing these patients by always being aware of their well-being, providing them emotional and physical support, and to monitor their treatment plans. We hope with the completion of this project, families and the community can be more aware of the well-being of elderly around them and to do what they can to help ease their suffering. And with that, we thank everyone who has directly or indirectly contributed in our project.